So, hello students. Today we will talk about the posterior abdominal wall, part 1. In this topic, we will talk about the muscles and the nerves in the posterior abdominal wall. The pictures are either hand-drawn or it has been taken from the Google images or from the books. What we will learn in this topic, or by the end of this teaching session, you could be able to describe the muscles of the posterior abdominal wall, its origin, insertion, action, and the nerve supply. You could enumerate the nerves of the posterior abdominal wall, and you could describe the lumbar plexus, its location, formation, and the branches. So, first of all, we will take the anatomical construction of the posterior abdominal wall. So, first we talk about the picture of a typical lumbar vertebra. So, this is the body of the lumbar vertebra. This is the lumbar vertebra only. And we could see that this is the body, this is the anterior one, and this part is the posterior one. Now, what we have got? We have got the body, and after the body, what we see is this is the pedicle. This is called the pedicle. And the pedicle continue with the lamina. So we have got the lamina over here. This is part of the lamina. And the most important thing is that from the pedicle and the lamina, what we see, this is the transverse process. This is the transverse process. Since this is an anterior one, so it could be considered as the anterior part of the transverse process, and this could be considered as the posterior part of the transverse process. And this is the spine of the lumbar vertebra. With this knowledge, we go further to say that this is the anterior aspect and this is the posterior aspect. This is the internal oblique muscle and this is the transverse abdominis muscle. So this is the anterior abdominal wall is over here. Anterior abdominal wall is over here. And we could say that this portion here we have got the posterior abdominal wall. So we have got the anterior abdominal wall over here and we have got the posterior abdominal wall over here. In this diagram, you could see again that this is the body of the lumbar vertebra. This is the pedicle and the lamina. And what is the most important is that the thoracolumbar fascia. This thoracolumbar fascia is having the three components. It has got the anterior component, it has got the posterior component, and it has got the intermediate component. So this is the posterior layer of this one is the posterior layer of the thoracolumbar fascia, and then this one is the intermediate layer of the thoracolumbar fascia, and this one is the anterior layer of the thoracolumbar fascia. And in this way, the thoracolumbar fascia is being completed. And we have got here the Psoas muscles, and we have got the Psoas fascia over here, the Psoas fascia over here. So in this way, we could say that this portion, if you complete this one, we could say that this is the anterior wall, and this portion forms the posterior wall of the abdomen. And this is after that we have got our back region. This is the back region. So this is for the orientation of the abdominal wall. So the posterior abdominal wall, when we think of the posterior abdominal wall, we have to be in front of the pedicle and the lamina, because behind the pedicle and the lamina, we have got the region. That region is known as our back region. Now, what are the important skeletal components which is being essential for to understand the posterior abdominal wall? The number one is the T12 vertebra, then the number two is 12th rib, L1 to L5 vertebra, iliac crest, and the iliac fossa. Why? So, because of the attachment of the muscles over there. So, this one is the L1, this is the L1, this is L2. So, just before the L1, we have got the T12. So, this region is the T12. And we could see the 12th rib coming out from here. 12th rib coming out from here. So we have got 12th vertebra and the 12th rib over here, because we know that the 11th and 12th rib is having only the attachment on the vertebral side only. They do not have the attachment on the sternal side or will attach with any other ribs, because they are completely the floating ribs. And this one is the iliac crest. This one is the iliac crest. And attaching to the iliac crest, see this is the transverse process. We have seen the transverse process at the junction of the pedicle and the lamina. The lateral mass which is going is known as the transverse process, and the posterior mass which is joining the two lamina is known as the spinous process. So this one, attaching this one, the transverse process attaches to the iliac region, and this creates the iliolumbar fossa, which we will see in next slide also. This one is the iliac crest, and this one is the iliac crest, and here we have got the iliac fossa. This region is known as the iliac fossa. Now coming to the next, we have got the ligamentous background also. So the iliolumbar ligament, as we have just seen. So if we, in this diagram it is more clear. So this, from the transverse process of L5 to the iliac region, we have the iliolumbar fossa. So we have got the iliolumbar fossa over here. Iliolumbar ligament over here, iliolumbar, connecting the transverse process of L5 to the iliac region. Then we have got the anterior longitudinal ligament. The anterior longitudinal ligament, we know that the vertebral body is being wrapped by the anterior longitudinal ligament, and the posterior longitudinal ligament posteriorly. So, and the ventral sacroiliac ligament, the sacrum is connected to the ilium over here by the ventral sacroiliac ligament. Now the musculofacial background, which we have just seen now, that we have got the anterior abdominal wall on this side, and the posterior abdominal wall. After removing the anterior abdominal wall, removing the peritoneum, removing the viscera, now we are seeing the posterior abdominal wall over here. We are seeing the posterior abdominal wall over here. So this is the vertebra, and the most important thing is that we have got the Psoas over here. This is called the Psoas. Then we have got the Quadratus Lumborum, and we have got the transverse abdominis. This is the Quadratus Lumborum, and this one is the Psoas major muscle. This is the Psoas major muscle. So these are the three important muscles which are actually forming the floor of the posterior abdominal wall, or they are actually responsible for forming the posterior abdominal wall. The transverse abdominis is continuous anteriorly, and this is how actually this transverse abdominis you will see in the anterior wall, lateral wall, and the continue over as the posterior wall also. So coming to the first muscle, that is known as Psoas major muscle. We have got a Psoas major muscle, then Quadratus Lumborum, then the transverse abdominis. We need not to read over here, because transverse abdominis is being considered under the heading of the anterior abdominal wall. So the Psoas major muscle, it occupies three regions. This Psoas major muscles, it occupies the three regions. What are those muscle regions? It is abdomen, then false pelvis, and the upper thigh. It does not enter into the true pelvis. So it is in the abdominal. This region is the abdominal. This region is the abdominal region. This region is the abdominal region. Then we have got the false pelvis over here, and finally it comes to the attached to this lesser trochanter. So it has got 14 fleshy strips by which this strong muscle, that is Psoas major, originates from T12 to L5. From the lower border of T12 to the upper border of L5. Then one disc above fifth lumbar vertebra, adjoining part of all the vertebrous bodies, and the fibrous arches across the side of the upper four lumbar vertebra. Actually, this, we have got the vertebra over here. We have got the vertebra over here. We have got the intervertebral disc over here. We have got the intervertebral disc over here. So by the side of this one, we have got this one, this fibrous arch over here, which connects the one body to the other body. And from here also, this muscles, that is the Psoas major, it comes out. So it's coming out from the T12 to L5 vertebra. Of course, the vertebral, intervertebral disc will be covered, and the fibrous arch across the side of the upper four lumbar vertebra. This fibrous arch, from here, it will also come out. It get inserted to the as a iliopsoas tendon. It combined with the iliacus muscle, and it will get inserted to the at the lesser trochanter. It is getting inserted at the lesser trochanter over here. It is getting inserted to the lesser trochanter over here. It is supplied by the ventral rami of L1 to L5, L4, and this muscle is the chief flexor at the hip joint. This is muscle which is responsible for the flexion at the hip joint, and the bilateral muscles of both the side of the iliopsoas help in flexion of the trunk. It will help in the flexion of the trunk. The trunk will be flexed, and it also medially rotate the thigh. It will also medially rotate the thigh. But the most important thing, that it is the chief flexor of the hip joint. It is the chief flexor of the hip joint. Then we have got the psoas fascia. Any muscles is being covered by the fascia. We already know. So it covers the psoas muscle. Its attachment is very important because it is attached to the thickened and from the medial arcuate ligament, or it is attached to the medial arcuate ligament. We have seen the medial arcuate ligament and the lateral arcuate. Medial arcuate ligament from the transverse process of the body of the L1 to the tip of the transverse process, the L1 transverse process. So this the medial arcuate ligament attachment, and it is attached to this one. Laterally, it fused with the entire layer of the thoracolumbar fascia, because it is very intimately related to this one, thoracolumbar fascia. Medially, the body of the lumbar vertebra and the intervertebral disc, and inferiorly fused with the fascia covering the iliacus, and it formed the sheath around the around the psoas muscle, that is known as the psoas sheath. So we could see that this is coming from the above. It is attached to the medial arcuate ligament, inferiorly to the iliacus, medially to the lumbar vertebra and the intervertebral disc. So this is how we will get the covering of the iliopsoas. The psoas sheath. So we will get the psoas sheath over here. Now coming to another muscle, that is psoas minor muscle. It is seen in 50% of the cases only. Normally, it is not present in each and every individual. It has got a common origin with the psoas from the T12 to L1 only. Here is the difference, because we have got T12. This is short. This is the short origin. This one is a short origin, and we have got the origin of the lumbar, the psoas muscle up to here, all up to here. It is coming all up to here or here only. But what we are seeing over here, that this is this much region only. Only this much region only is being taken care of. From here, this psoas minor muscle is coming out, and it is lying on over the psoas major muscle, and it gets inserted to the. It is not going to the trochanter. Instead, it is coming to the iliopubic eminence. Coming to the iliopubic eminence over here, and it is supplied by only L1 ventral rami of the. Now coming to the quadratus lumborum, the next important muscle of the posterior abdominal wall is the quadratus lumborum. So it is coming from it is the most lateral muscle of the posterior abdominal wall. That meaning by what? The transverse abdominis is only continuous with the posterior abdominal wall. It is that's why it is not being considered under the heading of the muscles of the posterior abdominal wall. It originates from the iliolumbar ligament. So we have seen that from the transverse process of L1, there is a ligament which is connecting the iliac crest, and this ligament is known as the iliolumbar ligament, and from here the quadratus lumborum originate. and originate from the adjacent part of the iliac crest, and the lumbar vertebra transverse forces of the lumbar vertebra, it get inserted to where? Get into the medial part of the inferior border of the 12th rib. See the 12th rib, and it is getting inserted to the 12th rib only, and slip to the transverse forces behind the slip of the origin. It will also slip to the transverse forces, and its nerve supplied by the upper lumbar nerve and the subcostal nerve. It will be supplied by the upper lumbar nerve and the subcostal nerve. The meaning by what this muscle, normally muscles are, the psoas major was also coming from above downward, but this quadratus lumborum is going from down to up. It is going down to up. So this quadratus lumborum muscle is taking origin from the iliolumbar ligament and from the iliac crest also, iliolumbar ligament and the iliac crest also, and it is going up and getting inserted to the 12th rib. We have, in the beginning of our lecture, we have already discussed about the skeletal element which is important for this reason. That was one of the most important was the 12th rib, 12th thoracic vertebra, iliac crest. So the 12th rib is why this 12th rib is important over here. We have seen over there. And what will be function? It help to fix the 12th rib during inspiration. Is attached to the 12th rib, so it will help the 12th rib to fix during inspiration. And bilateral muscle help in extension of the lumbar vertebral column. The lumbar vertebral column is being extended with the help of bilateral action of the quadratus lumborum, and act singly, it is the lateral flex, causes the lateral flexion of the lumbar vertebra. So now coming to the iliacus, it is this region. See this one. This is the iliacus region coming from here. This is the iliacus muscle. So origin from the upper 2/3 of the iliac fossa, and inserted with the common tendon over a lesser trochanter. Medially will be the psoas and laterally will be the iliacus. And the nerve supply will be the femoral nerve, and action again, it will be the flexor of the thigh at the hip joint along with the psoas muscle. Now coming to the iliac fossa, we have seen the psoas fossa, so we will see the iliacus, fossa iliacus. So this covers the iliacus muscle. Fossa attachment. See this one is the fossa. This one is all the fossa over here. Medially, it will merge with the psoas fossa and attach to the iliopectinean eminence, because iliopectinean, this one is the iliopectinean eminence, and so after merging with the psoas fossa, it will come to attach to the iliopectinean eminence. Inferiorly, passes deep through the inguinal ligament and attach to form the posterior layer of the femoral sheath. It will form the posterior layer of the femoral sheath. So we have seen the femoral sheath, posterior layer is being formed by the iliacus, and anterior layer is being formed by the transverse abdominis muscle. Now the important structure, that is the triangle, which is of the surgical importance, triangle of Marsili or the lumbosacral triangle. So what is this lumbosacral triangle is? Since this is a triangle, so it must have the 3 boundaries. It will have the 3 boundaries. So what are those 3 boundaries? If this is medial, this is lateral. So medially it is the L5 vertebra, and the laterally we have got the medial border of the psoas major muscle. And this apex will be formed by meeting of the medial and lateral, and the base will be formed by the sacral promontory. The base will be formed by the sacral promontory, or the base will be formed by the ala of the sacrum. This is ala of the sacrum. Ala of the sacrum will form the base, and the floor will be formed by the transverse forces of L5, and the iliolumbar ligament. Transverse forces of L5, iliolumbar. So we could draw the triangle over here in this way. See, this is the L5 vertebra. This one is the L5 vertebra. This one is the L5 vertebra. And this one is the psoas muscle. So we have got the one structure over here or one structure over here. 2 are meeting over each other, and then we have got the ala of the sacrum. And in this way, we form the triangle, and this triangle is known as the lumbosacral triangle. What is the importance of this lumbosacral triangle? Is the ureter crosses the common iliac vessels at this triangle, this lateral and at the lateral angle. So this is the importance of this lumbosacral triangle is not knowing the boundaries or the structure which forms the boundary of the lumbosacral triangle, but its importance lie that the ureter crosses the iliac vessels at the lateral angle. Now coming to the important reason, that is the nerves of the posterior abdominal wall. We'll see the nerves of the posterior abdominal wall, and what we will see, what are the nerves which is important in the posterior abdominal wall through which we will go. So this is the one is the lumbar plexus, then the abdominal part of the ANS, sympathetic, and the thoracic splanchnic nerve, greater and lesser nerve, and then the lumbar splanchnic nerve, parasympathetic nerve, and branches of right and left vagus. So coming to the lumbar plexus, this lumbar plexus, as the name suggests, is the plexus means the combination of 2 or 3 or more nerves. So the plexus of the nerves on the posterior wall, nerve taking part at the ventral rami of L1, L2, L3, and L4 upper part, because the lower part will form, does not take part in the participant formation, as L5 to form the lumbosacral triangle with the sacral plexus. The lumbar plexus innervate the lower abdominal wall. It will innervate the lower abdominal wall, but it is chiefly concerned to supply the skin and muscles borrowed from the trunk by the lower limb. So since the lower limb will come from the above downward, so actually this lumbar plexus is meant to supply the skin and the muscles of the lower limb. So the anterior primary rami, these are the anterior primary rami. This is the anterior one, this is the posterior one. So we have got this rami is anterior, and this one is the posterior rami. This is the posterior rami. So anterior rami of L1 to L4 emerges from the respective intervertebral foramen. They will emerge from the same level, from their same level, and enter the substance of the psoas. See the psoas over here, and they will definitely enter into the substance of the psoas and give off branches to the psoas and the quadratus. Immediately they will give branches to the psoas and the quadratus. Psoas and the quadratus, and after this they will form a plexus. After giving branch to the psoas and the quadratus, after that they will form the plexus, and the lumbar plexus will lie within the substance of the psoas major muscles. So to explore the psoas, the lumbar plexus, we have to cut the psoas muscle. Only then we could see the lumbar plexus, which we could very easily identify over here, that after cutting the psoas major muscle, we could see easily that we have got the lumbar plexus over here. If we will not remove the psoas major muscle from here, we could not see the lumbar plexus over here. So now the branches of the lumbar plexus, see this L1, L2, L3, L4, and L5. These are the structures which are forming the lumbar plexus. This will form they will form the lumbar plexus. And the branches will be from the L1. The L1 will form the two branches. One is called the iliohypogastric and ilioinguinal. See, the value of the both is L1 only. L1 and L2 combine together to form the genitofemoral nerve, and we could see the L1 and the L2 forming the genitofemoral nerve. Then we could see that the L1 and L2 and L3 combine together to form the lateral cutaneous nerve of thigh. These are all the ventral lemma we are talking about. The dorsal lemma will come over here. These are all the posterior division, and these are all the anterior division. So femoral nerve, L2 and L3, L4. L2, this is the femoral nerve coming from L1, L2, and L3. Is formed the femoral nerve. And the obturator nerve is being formed by the L2, L3 and L4. L2 and L3, L4 will form the obturator nerve, and the lumbosacral trunk will be formed by the L5 and the S1. Sometime accessory obturator nerve will be formed by the L3 and L4. So this one is the posterior division, will form the accessory obturator nerve. We have already read about this lumbar plexus in our previous classes. So relation of the Psoas major muscles and the branches of the lumbar plexus. And this is very important. This has already been asked in the NEET examinations. Identify the nerves which is coming from here or which is lying on the lateral aspect, which are lying on the medial aspect. This question has already been asked in the previous NEET examinations. So we have to see that first we have to identify the Psoas major muscle, and what we have come to know that to identify the lumbar plexus, we have to cut the Psoas major muscle, that it is lying within the substance of the Psoas major muscles, and only the two branches, that is the branches for the Psoas major muscle and the Quadratus Lumborum, they are emerging before it forms the plexus. So if it is within the substance, so something will come on the lateral side, some branches will come on the medial side, and some branches will come on the top. So these are the branches which are coming from the lateral border of the Psoas major muscles, and these are the iliohypogastric. Number one, iliohypogastric. Number two is the ilioinguinal. This is the ilioinguinal. And number three is the lateral cutaneous nerve of thigh. This is the lateral cutaneous nerve of thigh. This one is the lateral cutaneous nerve. This third one. This is the third one is the lateral cutaneous nerve of thigh. Then we have got the femoral nerve over here. This is the femoral nerve. This is the femoral nerve over here. They are all coming from the lateral aspect. Through the Psoas and coming on the top, this one is the genitofemoral nerve. This is very important. This is the genitofemoral nerve. And on the medial aspect, what we will see over here, this one is the obturator nerve. This is the obturator nerve. So medially, we have got the one nerve that is known as the obturator nerve. Laterally, we have got the four nerves: ilioinguinal, iliohypogastric, lateral cutaneous nerve of thigh, and the femoral nerve. From this substance coming on the top, that is the only one nerve that is known as the genitofemoral nerve. Now coming to the abdominal part of the ANS, so what is the importance of the autonomic nervous system in the abdominal region? We already know that the sympathetic outflow is thoracolumbar only. And the parasympathetic one is known as craniosacral. It will receive both the sympathetic and the parasympathetic nerve. Sympathetic supply will be of the lumbar part of the sympathetic chain and the thoracic part of sympathetic chain. Because we have a thoracolumbar segment, so it will have either the lumbar or the sacral. The lumbar will give both somatic and the visceral branches. The lumbar, the sympathetic trunk coming from the lumbar region will give both somatic and the visceral branches. The somatic branches will supply the lower abdominal wall and the lower limb. This will take care of the lower abdominal wall and the lower limb. And the visceral branches will supply only the pelvic organ. This is very important question, that it will supply only the visceral organ. So the lumbar part of the sympathetic chain will supply only the pelvic organ regarding the visceral branches. The thoracic branches of the sympathetic chain will supply through the celiac plexus and will give branch to the visceral branches, and visceral branches will supply all the abdominal organ, including the gonads. So thoracic is above and lumbar is below, but thoracic regions, sympathetic chain, it is taking care of all the viscera, including the gonads, whereas the lumbar region, sympathetic chain, visceral fibers, they are taking care of only the pelvic viscera. Regarding the parasympathetic, they are twofold supply by the vagus nerve from above and the pelvic splanchnic nerve from the below. That is the sacral outflow. Then we have got the lumbar sympathetic chain. We could see over here the lumbar sympathetic chain. Now it will enter the abdomen behind the medial arcuate ligament. It will enter through the abdomen behind the medial arcuate ligament. And what is this medial arcuate? This medial arcuate ligament is nothing but it is the ligament of the diaphragm. So it will come be behind this medial arcuate ligament, and it will descend in front of the lumbar vertebra. See this one. This is the lumbar sympathetic chain. We could identify over here. We have got the lumbar sympathetic chain over here. This one is the lumbar sympathetic chain. This is the lumbar sympathetic chain over here. So this one is the lumbar sympathetic chain over here. So it will descend in front of the lumbar vertebra, and along the medial margin of the psoas, along this one, we have got a psoas over here. We have got a psoas over here. So it will be, this one is the psoas, and this is the psoas, and it is medial to the psoas. This is not lateral to the psoas. It is medial to the psoas. Right trunk is behind the inferior vena cava. So inferior vena cava will be right on top, and the left trunk along the left margin of the aorta, and the left trunk will be on the left margin of the aorta and passes in front of the lumbar vertebra, but behind the common iliac vessels. See the common iliac vessels over here, and it is behind the common iliac vessels. This nerve is going behind the common iliac vessels. So what we have seen over here, that it is the psoas major muscle. The psoas major muscles, it is medial to the psoas major muscle, coming behind the medial arcuate ligament. It is behind the inferior vena cava. This is behind the inferior vena cava, but on the right side, on the left side, it is left margin of the aorta. It's lying along the left margin of the aorta. Now we could see the ganglions over here. So the ganglions are usually 4 in number. The sympathetic chain will always supply through the ganglion, because the preganglionic fiber and the postganglionic fiber we already know. So give up the somatic and the visceral branches. We already have seen this one. So the somatic branches, the grade MI communicants, passes from the ganglia to all the 5 number fibers. So we could see the ganglion over here. We could see the ganglion over here. We could see the ganglion over here. So from the ganglion, they will to all 5 the lumbar region. They will all go to all the lumbar region. Lumbar region, and supply the body wall and the lower limb. The visceral branches, that is the lumbar splanching nerve, arises from the lumbar ganglion, and they will join either this aortic or the inferior hypogastric plexus, superior hypogastric plexus, either lumbar plexus or the superior hypogastric plexus. So celiac plexus, you could see the celiac plexus over here, celiac plexus and the celiac ganglion right over here. This one is the celiac ganglion. You see lying along the celiac trunk, consists of right and left celiac ganglion. They are detached part of the reticulorenal ganglions and receive preganglionic sympathetic fiber. Of course, all the ganglion will receive the preganglionic sympathetic fiber through the greater and lesser splanching nerve, and the preganglionic fiber relay in the celiac ganglion, and the postganglionic fiber, the ganglion from the celiac plexus, and the postganglionic fiber passes along all visceral branches of the aorta to reach the abdominal viscera. So since we already know that the sympathetic plexus, either they always look for any viscera, any blood vessels. So the celiac from the branches from the celiac plexus will look for the branches of the abdominal aorta, and they will travel all along the abdomen along with those blood vessels, and they will supply all the viscera in the abdominal region, including the gonads. So coming preganglionic fiber coming from through the splanching nerve, reaching the celiac ganglion. From the celiac ganglion, the postganglionic fiber forming the celiac plexus, and from the celiac plexus, it is all the branches, they travel along with the branches of the aorta to take care of or to supply the different abdominal viscera, all the abdominal viscera. So they are action of the sympathetic plexus. It is vasomotor. It is motor to the sphincter. It will motor to the sphincter, and it inhibitory to the peristalsis. It will inhibit the peristalsis, and it will carry the sensory fiber for all the viscera, and the suprarenal medulla receive preganglionic fiber without relay, causes release of adrenaline from the adrenal medulla. This is the exception that the suprarenal medulla this receive the preganglionic fiber directly without any relay, and this will causes the release of the adrenaline from the adrenal medulla. Now coming to the parasympathetic one. So the parasympathetic one, it is coming from either vagus or vagus nerve or the pelvic splanchnic nerve. So coming from the vagal nerve, both the trunk contain the, and where from it comes to the abdominal region. It comes from the esophageal opening over here. You could see this is the esophagus, the esophageal opening in the diaphragm. Through it will come out, and the both vagal trunk both contain the fiber from the right and left vagus nerve. They enter the celiac plexus. They will enter the celiac plexus and passes without relay. They will not relay over, because it is the vagus nerve. It is the parasympathetic nerve. It carrying the parasympathetic nerve, so it will not relay over here. It will not relay in the sympathetic, and this celiac plexus is the parasympathetic one, so it will not relay over here, and we supply the viscera, and gut will also be supplied up to the transverse colon. Up to the transverse colon, it will be supplied by the vagus nerve, and splanchnic plexus onwards, the parasympathetic nerve will come from the pelvic splanchnic nerve. So up to the transverse process, the parasympathetic fiber is being taken care by the vagus nerve, and from the splanchnic plexus below, it is the pelvic splanchnic nerve which take care of the blood, these nerves, parasympathetic supply of the gut. Now regarding the actions, stimulate the peristalsis. The sympathetic one was inhibiting the peristalsis. It is inhibitory to the motor, that was motor to the sphincters, the secretomotor to the gut and the gland up to transverse colon, because it is transverse colon up to the transverse colon only the vagus nerves take care of supply. Beyond the splanchnic plexus of the colon, the rectum, it is the splanchnic nerve which will take care of. So now some applied anatomy. So appendix and the right psoas muscles. The retrocecal appendix, we have all and cause the inflammation of the appendix. There will be a spasm of the psoas major muscles, and the patient will keep right thigh in the flexed and medially rotated positions, and this will form the basis of the psoas test. This will form the basis of the psoas test. Now, psoas abscess, any pus, if there will be any pus in the vertebral region, it will not go enter into the anterior abdominal wall because of the firm attachment of the anterior longitudinal ligament. So it find easier to push laterally, and it will come to the psoas major muscles, and the psoas above we have got the sheath over here, so it will pass along with the behind the sheath. So accumulation of the pus in the vertebral column, pus trickle along the psoas muscle with the psoas sheath, collection of the pus underneath the inguinal ligament also, and from the inguinal ligament, the swelling is going below the groin, up to the groin region below the inguinal ligament. Now finally, the last topic or last slide of today's topic is the Meralgia Paresthetica. This is nothing but the lateral cutaneous nerve, since it is passing deep to the inguinal ligament. So sometimes it may pass through the substance of the inguinal ligament. Normally it is passing below the inguinal ligament, but sometimes it may pass through the substance of the inguinal ligament, and it may entrap and causing the pain along its distribution. This is the reason where it causes the altered sensation. So this is all about today's topic. Thank you.